The Ghana Health Service has stated that although Ghana is currently experiencing a fourth wave of the COVID-19 pandemic, there has been a significant reduction in cases over the last week. Thus, in consultation with the National Immunisation Advisory Committee and with the Health Minister's approval, they have come up with some new policy guidelines to enhance the fight against COVID-19. The first is the isolation policy for international arrivals into Ghana. The Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, stated that all Ghanaians and resident foreigners who were partially vaccinated or unvaccinated would be vaccinated upon arrival.
The new guideline is that Ghanaians and resident foreigners who are partially vaccinated or unvaccinated are exempted from the requirement of full vaccination before traveling to Ghana. However, they'll be offered vaccination on arrival, and if they fail to take the vaccination offer, they go on mandatory quarantine for 7 days at their own cost.
The de-isolation and discharge times of persons who test positive for COVID-19 has also been reviewed from 14 days to 10 days.
All those who test positive and are managed at home will be de-isolated 7 days after testing positive. So which means that if you test positive today, you are not sick, you are just mildly sick, you are able to manage at home, within 7 days, you'll be able to return back to work.
Dr. Patrick Kumar-Boaji stated that certain categories of persons had also been approved to take a COVID-19 vaccination booster dose 3 to 6 months after their last vaccination.
Booster will be offered to all health workers. Will be given booster, and the booster is 3 to 6 months after your last vaccination. And so that will affect all health workers, persons with underlying medical conditions such as diabetes, hypertension, persons 60 years and above, frontline security personnel, and members of the executive, judiciary, and legislature.
The Ghana Health Service has also approved the Moderna and Pfizer vaccines to be given to pregnant women.
Pregnant women who are unvaccinated will now be can now be vaccinated. Previously, it was not policy to vaccinate them. Now they can be vaccinated. And they are recommending that we use either Moderna or Pfizer, which is the mRNA technology, to vaccinate them.
According to the service, the vaccine mandate is still being discussed and its date of commencement would be communicated in due time.
Areas of the mandate already, I think the group that still exists, as was mentioned earlier, is all health workers, students, secondary school, frontline, security personnel, and commercial drivers. But I think further consultation is going on, and once the minister is convinced as to those who fall, the persons and the venues that will be chosen and the date will start, that will be announced.
In order to help drive COVID-19 cases further down, the Health Service is instituting an intensive 5-day COVID-19 vaccination drive in February.